back to you.
Thanks, Rich. Well, where do we stand on this legislation, and are the latest job numbers rattling any lawmakers' nerves as they consider a major spending program?
Well, here to talk about it, Democratic Representative Joe Sestak from Pennsylvania and Republican Brian Bilbray of California. First to you, Mr. Bilbray. Do the job numbers, is that of a concern to people voting down there in Washington on health care reform?
Well, the job numbers have to. The economy is obviously the major focus of everybody. No matter what we talk about, the fact of if people don't have jobs, you're going to have major problems across the board. So, yeah, the economy is the #1 issue. Everybody's got to admit that.
Congressman Sestak, the vote this weekend, we're hearing that it's on, we're hearing that it's off. Can you give us the latest?
Well, I just asked before I left the House floor where it was, and I was told leadership doesn't know if they have the votes yet. But I believe you're going to see it come to the floor. It has to. If it doesn't come to the floor, then it admits they don't have the votes. I think it's time to bring this to the floor and have closure upon it. I think everybody's had sufficient time to look at it and review it.
Forgive me, but you wouldn't bring it to the floor unless you're sure you have enough votes to pass it.
No.
Is that what you're saying?
No. We should bring it to the floor no matter what. We should stay here until it's brought to the floor. If they want a few more days, keep us here. Matter of fact, I voted this morning against adjournment because the adjournment did not have in it staying here until we have a vote.
All right, but Representative Bilbray, does this make sense that you bring a vote to the floor when you, a bill to the floor when you may not have the votes for it? What do you think of that move?
I think it's when your rank and file are really tired of the arm twisting, and frankly, there's a whole lot of pressure going on back and forth. But I think that even Speaker Pelosi recognized there's a limit that she can put her membership through. There's so much of this that you can ask people to bear until you finally said, okay, we're going to flip the coin and see how it falls.
Now,
I think
Congressman Sestak, this thing is 2,000 pages long. We're not even sure it's going to be online before the vote, but are you concerned about timing here, whether it passes before the Veterans Day recess?
See, I'm not as concerned about representatives sent down here to do their jobs and whether this arm twisting is or isn't going on. What I'm concerned about is literally those who come into my office that can't wait another day because they're being denied health care by their insurance company for a pre-existing condition. 14,000 Americans every day lose their health care plan. Now, you just mentioned 2,000-page manual here. You know, when I had aircraft lift off of my aircraft carrier, that op order was often several thousand pages long because of the requirements. If we're going to tell the public we're not doing health care reform because something's too long, my gosh, we could do what we did the last 8 years, which is not even have a single piece of paper and have 10 million Americans lose their health care. Let's move forward. This is a hard problem. We need to have an up or down vote by people standing up for what they believe.
You know, Representative Bilbray, basically, both sides of the aisle are in agreement, I think. You do want to insure the poor. You do want to fix the health care reform, have health care reform. The Democrats, I think my sense is that they're going to be rewarded for this package, which could take another IRS to collect it. How do you think the stock market will react to this bill?
Well, first of all, I've got to remember this, everybody talks about it has to be done now, but it doesn't go into effect until 2013. What starts off is the tax system, but benefits don't show up for another 4 years. So obviously, you have different agendas here, but when the stock market takes a look at this, right now when jobs are down, jobless are up, that the economy is slow, we need to have small business stimulated. The last thing we need is to start scaring people away from making those investments, investing in new businesses, small businesses, expanding and hiring people. And with a jobless rate over 10%, right now is a very scary time to tell those small businesses, which are the backbone of employment, that, oh, by the way, we're going to throw another new tax on top of you.
Congressman Sestak, you're a man of your word. You're a former U.S. Admiral in the Navy. Are you willing to guarantee to the public that if this passes, it will not add to the deficit?
Yep. According to the Congressional Budget Office, and I went through their analysis, it does not add to the deficit.
But they were terribly wrong with Medicare. You know that. They were off by a factor of 10.
Yes. They could be off up or down 10%. I don't know which. But I do know this. Not doing anything, as we've done for many years, is not going to bring about reform. And I'd like to address small businesses because I'm vice chairman of the Small Business Committee. They pay 18% more on taxes, really a tax with quotes around it, that is of higher health cost because they can't spread the risk like big corporations. So 18% more than like Boeing does. But we're going to now remove that by letting them spread the risk. In fact, if you're a company of 50 or less employees, you don't have to provide health care. So that's why we're not putting any burden on small businesses.
Joe Sestak, Brian Bilbray, great to see you both. Thank you very much. I hope you don't have to work the whole weekend. We appreciate you being here. Here's a look at what's still ahead today on Bulls and Bears.
Unemployment over 10%.